I'd like to call the Health Hospitals and Social Services meeting to order. It's Tuesday, October 20th, 2020, and we're starting 5:33. And we have a few bills here, and then I'll also like to open the floor up for discussion in regards to special call meeting tomorrow for the Nashville Long-Term Care Facility. RS 2020-590 by Toombs, Taylor, Hauser, Swora, and Welsh appropriates some funds from the U.S. Department of Health and Human Services to the Metro Action Commission to support the Head Start program by funding a comprehensive child development program for disadvantaged children. And I also like to take item 591 with this as well. RS 2020-591 approves amendments 2, 3, and 4 appropriating funds from the U.S. Department of Health and Human Services to the Metro Action Commission to support the Head Start program by funding a comprehensive child development program for disadvantaged children. I'd like to move this legislation. It's been moved and properly seconded. We do have representatives from Metro Action Commission. Would you guys like to share with us? Oh, okay. Please.
Good evening, ladies and gentlemen. I am Dalva Weathersby, and it's my pleasure to serve as the Director of Early Education and Youth at the Metro Action Commission. Essentially, the information that we have, and I'll just summarize very briefly, and that is the first two amendments, as is Head Start's customary way, was to update an administrative change with an EIN number. So those are very, very, very benign, if you will, in terms of the function and content. So those were two. The other piece is the cost of living adjustment and the quality improvement. That's one-time funds that are often allocated once a year, not always, but as allocated by Congress. And so those resources have been allocated. And the other piece is the part of the CARES fund with the allocation that is for the COVID-related expenses. And as you would imagine, operating a child care program in this day and time has lots of additional cost and obligations. And so we were awarded a piece there in terms of allocations in order to meet those additional requirements from the Department of Health and Human Services. So that, in summary, is what you have before you regarding the amendments and the grant awards from the Department of Health and Human Services.
Any discussion from Craig? Yeah.
Also, thank you very much. I'd just like to say that I have the pleasure of serving on Metro Action's Commission's board, having been the chair of Health and Hospitals. And when I tell you that the program that they have in Head Start is robust, and they have been doing a fantastic job. I want to also recognize Mr. Marvin Cox, who's here for Metro Action. They dot every I, cross every T, make sure that they spend every dime that they have to take care of those kids and those employees that are there. I'm so proud and so grateful for the work that they do at Metro Action that I could not sit and not say something. So thank you very much. Anything that they bring through, I feel very confident that they are going to use it to the best interests of those that they serve.
Councilmember Hauser.
One of the reasons that I'm a co-sponsor on this is actually my oldest daughter was in the free Head Start program. I think that's what you're doing. And it really is quickly moved to have it.
Discussion. All in favor, please say aye. Aye. Any opposed? No abstentions? All right, motion passes. All right. RS 2025-92 by Swore Toombs, Taylor, Allen, and Welsh appropriates subrecipient grant agreement funds from the Metro Development and Housing Agency to the Metro Action Commission to address rent and mortgage assistance for up to 3 months for eligible households resulting from the COVID-19 pandemic. All right, it's been moved and seconded. Mr. Cox, would you like to share with us?
Cox, I'm the Family and Community Services Director. These funds are through the Community Development Block Grant at MDHA, and it would allow us to assist individuals who've been impacted by COVID-19 up to $1,400. But what it allows us to do to assist them a longer period up to 3 months.
Thank you so much. In discussion? I would like to add that this is for individual families at 80% API as well, per discussion with Metro MDHA.
Just let people know how they can qualify for, what process they would need to go through for that.
If a person has been impacted by a layoff, and that layoff is beyond a month, and most times our program, we can assist for the monthly past due. But what this allows, if individuals have a month assistance, but they're still in the same situation, they can come back and get assistance again. So usually it's one-time assistance. What these funds would allow individuals to come up to 3 times if they need that much assistance. Yes, sir.
Good deal. Any other discussion?
No, utilities would be separate because we have the low-income home energy assistance program.
Is those funds still available?
Yes, ma'am. Mm-hmm. And that is one-time assistance.
Okay.
From October 1 to September 30.
All in favor, please vote aye. Aye. Any opposed? All right. RS 2025-94 approves Amendment 2 to a grant from the Tennessee Department of Health to the Metro Board of Health to provide chronic disease prevention and management services to reduce risk associated with diabetes, type 2 diabetes, or heart disease and stroke. All right. And I spoke with representatives from the health department, and this is just a grant that they have to apply for every year. Any discussion? It's been moved and properly seconded. All in favor? Aye. Any opposed? All right. RS 2025-95 by Taylor and others approves an amendment to an assignment and assumption grant agreement amendment of the Homeless Management Information Systems grant between the U.S. Department of Housing and Urban Development and the Metro Development MDHA to the Metro Social Service Department Homelessness Commission to contribute to the national effort to end homelessness. I would like to move to withdraw this bill.
That's withdrawn.
All right, thank you. So before we adjourn, tomorrow we have a special call meeting with Health Hospitals Budget Finance and Personnel Committee to discuss the contract agreement with, or the lack thereof, I guess, contract agreement with Signature Healthcare and Bordeaux and the city for Bordeaux Hospital. We want to add transparency to what's going on. We've had several family members and employees reach out to our committee and to the council, and this gives us an opportunity to answer some of their questions. I'd like to open the floor very briefly now because we have a few minutes before we get started for council meeting. We're going to be discussing this tomorrow, but is there any questions that you all have as a committee before tomorrow? Yes, sir.
I want to attend. I let Rosie know, but I already had a previous appointment.
Okay.
Engagement.
Thanks, Councilman Blower. It's at 4. It's a virtual meeting. Yeah. You should have received an invitation from Ms. Hayes.
came to find recently that there may be another option on the table in regards to things being carried on by Meharry and Anthem. And as I know, Councilman Hall has been working in his district regarding it. Just ask if he could give some updated information regarding that.
Thank you, Councilmember Hurd. So the overall conversation that started a long time ago about in the event that Signature chose not to stay, because they were already giving us inclinations of that other groups would be applying for an RFP and things of that nature to try to step in. Well, we've had such success with the group that's come in with Knowles and with their partnership through Meharry, installing an adult day center and doing some other things and having physicians on hand in rotation there. They've been just essential in the COVID process with Dr. Hildreth, Dr. Collins, Dr. Alcindor, and others from that campus. Going into this RFP process, they were actually considering participating in the RFP, but did not. And so because of the joint venture between the two, what they've done now is applied to the state to move some of those residents who would qualify from up the hill, just down the hill to the assisted living facility and continue their care there. And then are working towards the additional licensure and are about to go before the state, who solely regulates that component, to see what additional help that they may be able to provide. And so we're still gaining more information about that. There actually was a meeting set up today with the state. I'll send out the link for that, and anybody that wants to participate from this committee or from Metro, it'd be very welcomed. But I think that will allow for some employees and patients to immediately remain, because we know statistically 25% don't survive being displaced when they're long-term patients. And so we want to take every effort to take that most vulnerable group at least and try to keep them stable and in place immediately as we work towards what we can do for the rest of the group.
Thank you.
And I will have somebody at that meeting or on that meeting from those groups tomorrow.
Thank you, Councilmember Hall. Councilmember Benedict.
Thank you, Chair. Could you confirm who will be in attendance as it relates to who's going to speak to the committee? Please confirm who's going to be.
Yes, so I have invited the mayor's office, procurement, and our legal office to come. They've all accepted the invitation. I've also invited Signature Healthcare to join and speak to us on their behalf. I have not received an acceptance of their invitation at the time. Thank you. All right.
So General, will they be participating?
They will be there. They have received the invitation. They are not necessarily going to speak directly, but yet to answer any questions if Nashville General conversation comes up. Any other questions? All right, thank you so much. I'd like to adjourn this meeting.
This has been a service of the Metro Nashville Network. If you would like to see this presentation again, or for more information about this and other programs, visit nashville.gov.